IVM.
This last New Year's Eve, as most of us were celebrating the start of a new year, a set of pneumonia cases with no known cause was reported in Wuhan in China. In less than 3 months, COVID-19 has become a global pandemic, with over 180,000 people who've been infected. India has over 100 confirmed cases of COVID-19 as of March 17th, and we don't know how many untested cases there are and how much worse things can get over the next few weeks. Journalist Vidya Krishnan joins us on this episode of the Pragati Podcast to tell us about how India is responding to the coronavirus pandemic. Welcome to the Pragati Podcast, a weekly talk show on public policy, economics, and international relations. I'm your host, Pavan Srinath. Vidya Krishnan is a health journalist based in Goa. Her first book on the rise of antibiotic resistance and the threat to global security is slated to be published later this year. She's also been reporting deeply on the ongoing pandemic for the Caravan magazine. We'll start our discussion after a short break.
Hey everybody, welcome to another awesome week on the IVM Podcast Network. I hope you're all safe this week. Coronavirus hasn't stopped us here at IVM yet, and it is our 5th anniversary. You should be aware of that, and we'd like to thank ourselves for that. We'd like to thank our sponsors this week, HDFC Life and Paytm Money. Sponsors make this stuff possible. If you work for a brand which you think would benefit from sponsoring show on IVM, please do reach out to us. We appreciate that. On Advertising is Dead, Varun is joined by Sarvesh Shashi, founder and CEO at Sarva, to talk about how he got into yoga, his Guruji's 7-year challenge for him, and how Jennifer Lopez, yes, the Jennifer Lopez, ended up investing in his dream. On IVM Likes, Alika, Antriksh and Sumit talk about some weird and bizarre shows and movies that they've seen. Uncle Please Sit just launched last week. On the first episode, Joel and Tushar debunk some common myths around the world middle class in their unique and satirical way. This week, listen to them talk about food and all the disinformation around it. On Geek Fruit, Tejas and Dinkar just saw Pixar's new movie Onward. Tune in to find out what they thought of it. On Absolutely Right, Aditi is joined by Rachel Lopez. They dive into her personality by analyzing her handwriting. On the Empowering series, Zarina is joined by Rohit Taparia, Vice President of Isprava and Lohono Stays. They talk about the journey of an entrepreneur in the luxury home segment. And with that, let's get you back to your shows.
Hi, I'm Pavan Srinath and welcome to the Pragati Podcast. I'm here with Vidya Krishnan, who's joining me from Goa. Vidya, welcome to the show.
Hi, Pavan. Thanks for having me over.
It's my pleasure. But unfortunately, we've been talking about maybe recording a podcast, and we're doing so at a time when things are far from okay.
I know.
And on that line, my first question to you is, when we're talking about COVID-19 now, first of all, from coronavirus, it goes to this weird thing called COVID-19, which seems very alien and abstract. But people are talking about this as if it's a pandemic. What is a pandemic and how is that different from an epidemic, an outbreak, and other things that we've seen in the past?
So, according to WHO's classifications, there are 3 categories of disease outbreaks. The first one is called endemic, where the disease exists primarily in a particular region, in a population throughout the year. So you can find the pathogen in the community at any given point, say for malaria in India or
Right.
dengue. An epidemic is when this same kind of disease has outbreaks where more people outside of the limited region, it's not regional anymore, it affects several communities, and then it becomes
Okay.
a epidemic. A pandemic is when it affects the entire world, which is unprecedented, and WHO does not use this word casually. But they did classify, after a while of thinking about how to classify this, they eventually did classify it as a pandemic. And it has now spread to 162 countries. And as we are recording this, 180,000 cases have been, people have been infected, and over 7,000 deaths have been recorded around the world.
Wow. So, we've seen scares like this before, right? There's been SARS, there's been swine flu, there's been, I think, MERS in the Middle East. This is something bigger than all of them, right?
So we have seen things like this in the past, but not in this kind of severity. Like Ebola was scary for a while. SARS did not spread this badly to every region, and it was contained very quickly, even though it had a higher mortality than this. What we are seeing now is unprecedented as much because we don't know enough about the virus, but also because how extreme the health inequities are around the world. There are massive health deficits, really weak health systems in low and middle income countries, especially in Asian nations. South Asia is the world's most crowded part, and India and China are both very crowded countries. I would say we should all be very worried at this point.
Right. And this is a new normal that will be our reality at least for the coming months, if not the year, right? And that there's COVID that is going around, and it's about how our societies, our governments, and everyone get together to try and contain this, to maybe pause the spread, maybe slow it down, and figure out how to manage our lives around it. So in this, because today on our episode, we want to really talk about what India's response has been to COVID-19. And before we get to that, I think it's very important, even in this limited forum of this, the audience of this podcast, that we should put out a PSA to the extent possible. So to that end, Vidya, from everything that you're seeing right now, from what the government and the WHO have been saying, how should Indians be living their lives right now? What should they be avoiding? I know that the government has already pretty much shut down a lot of international air travel into the country. Every day we hear of new sort of inclusions to whatever's being limited. So with that being the scenario, how should we be behaving in a safe manner in our lives right now?
Thank you for asking me that. We should be practicing sneezing and coughing etiquette, which we should have been already, because India has a massive explosion of tuberculosis, which is also a respiratory infectious disease. What we should be doing is sneezing and coughing into our elbows, as much for our protection as for others around us. We should be suspicious of basically every solid surface you touch, because it could potentially have a virus, unless you know for sure that it has been cleaned by the last person who used it. We should wash our hands regularly in the specific manner WHO and the Health Ministry has asked us to. We should not be hoarding supplies like masks and gloves. Because healthcare workers like doctors and nurses need it more than us, and they are our society's first line of defense. If they fall, the virus will spread unchecked in the community. So every time we keep the masks, we have nurses and doctors who are caring for patients without a mask. So no hoarding, wash hands, do not sneeze at people, is what I would start with, but we will flesh these things out as we get into the podcast. There's a lot of do's and don'ts with this.
Thanks, Vidya. No, I think we should step into them right now.
Okay.
Right? So first, I want to talk with masks, because like you said, there's been a run on the masks in the entire country, right? And like, for example, air pollution masks, N95 masks sold by 3M and the like, were there on, I think, Amazon a year ago. Maybe 5 masks would cost you $100-$150. Now I think most of them don't exist. If they exist, they're like $750, $1,000. So people have gone out of the way to buy this. But wearing a mask now is probably a bad idea, right? Even beyond getting masks out of the system for healthcare professionals, because when we're using it for air pollution, it's one thing. But here, if the disease spreads through touch as well, then us fiddling with our face mask might put us at greater risk for the disease, right?
Yeah. So this question, basically, the only people who should be wearing a mask is that are healthcare professionals or families of people who are caring for someone who is unwell.
Right.
We should, Indians in particular, have been trying masks. Mumbai in particular, which is a global hotspot for the TB epidemic, we don't know how to use these masks. Even for air pollution, most of the masks that people have been using in Delhi are the wrong ones. And then it's a tropical country. The Indian summer is oppressive, and it becomes difficult to breathe. So you put your finger in, you allow yourself to take that one, gasp of breath. That is not a good infection control practice. Not only are you using the mask wrongly, you're keeping it from someone who needs it in a hospital to take care of themselves and for the patients they're taking care of. So no, I would say no masks for now. If you're not unwell, that's not going to help you.
Thanks, Vidya. On this lines, there's also a little bit of a confusion around coronavirus as whether it is airborne or not, right? So could you clarify that a little for us?
So it's a droplet infection, and it doesn't hang in the air.
Mm-hmm.
But if, say, I sneeze, and people do not realize that with every sneeze, how far it goes, and it's like a spray which can go. Like if I sneeze from the 6th floor of a building, this was a TB expert who explained to me at a government hospital in Mumbai. If the patient sneezes from the 6th floor of the building, the uninfected person on the ground floor who catches the droplet infection is at risk. So we need to be sneezing into our elbows. We need to be covering and shielding it with handkerchiefs. Best is to look up and educate ourselves. In other countries, children are taught in schools what is a sneezing or a coughing etiquette. We kind of need to learn all those basics at this point.
Yeah, we really need to. Maybe it's only at a time of crisis that some of these things can become habits, right? Because, sometimes I get very frustrated by a lot of people talking about building awareness. All of us are aware that we need to brush our teeth 2 times a day. How many of us brush our teeth 2 times a day? Not everyone, right? So I think the hope with a lot of these hygienic practices for me is that given that it's a time of a pandemic, maybe if people do it for 3 weeks, 4 weeks in a row, it becomes automatic, right? Because we brush our teeth in the morning not for health reasons, but because we wake up and we want to feel fresh, right?
Yeah.
So, we use a toilet not for health reasons, those of us who do in the country, but because it's convenient and for a lot of other reasons. So I'm hoping that, a tiny silver lining out of this is there are more hygienic practices that become habits among more people in the country.
So I feel that's a very interesting question because I'm fascinated by behavior science. And yes, there is research that says 21 days of doing something changes, like you go to the gym for 21 days and you now have the habit of doing it, and you kind of do it on autopilot and not because you want to get ripped. But also interesting is that, which again comes back to sneezing, coughing practices. India and South Asia, which is Bangladesh, India, Pakistan, have a huge TB incidence. I keep coming back to TB because everything that we are learning from TB can be applied to coronavirus. This region has a particular issue with men in particular, statistically, who spit a lot. And from research, I recently read a paper and found that this habit of spitting actually came into vogue when there was chewing tobacco. And chewing tobacco got phased out in most parts, like even in around the world, but even in India, urban centers prefer smoking tobacco over chewing tobacco, but men continue to spit because it's considered manly. And a lot of it is about our reflex, and we don't have the answers for things like, will we stop touching our face? Will we not spit in public? Will we sneeze better? We will find out, I guess.
Certainly. And I'm hoping that only at least on things like hand washing, things become more of a habit. On more complex things, again, the jury is out.
Yeah.
So given that this is the situation right now, so we talked about masks. So you're saying the government sort of advisory on sort of keeping a distance of at least 6 feet or a meter from other people. This is in the event of people coughing into their elbows, right? So if people are coughing openly, the spread is much more.
It is. I actually had somewhere, I've just finished writing a book on tuberculosis, and one of the chapters is essentially about this. I don't remember the numbers as yet, but I was horrified when I saw that it can go up to kilometers. So the WHO recommendation is of social distancing, where it says, like, the idea is to maintain a distance of at least 6 feet. But that's assuming you're sneezing into your elbow.
So basically, we should keep a little more distance from others. We need to sort of wash our hands, be wary of surfaces. We should not unnecessarily wear masks, should wash our hands often. What else should we be doing? I mean, social distancing is again a big term which could mean a lot of things, right? But practically, how do you see it working for most people in the country, or at least most listeners of this podcast, right? Because we do skew towards people who have a smartphone and who have the luxury to listen to a podcast.
So I'm going to very quickly just tell what social distancing means as per WHO. It says that maintain distance of at least 6 feet. Some states in India have already recommended that gatherings of more than 50 people should be avoided for the next few weeks. These measures are basically an attempt to enforce some distance between people, which would then break. If not break, it will not start new chains of transmission. It has been a proven way to slow down pandemics in the past. That basically means if you minimize contact between people, avoid public transportation, non-essential travel, work from home, and definitely skip social gatherings like don't go to a movie, don't go to a temple function. These are strategies that have saved lives both during the Spanish flu of 1918. They've saved lives as recently as the 2009 influenza in Mexico City. I'm concerned because even today in the morning, I was reading in the newspaper that there are massive gatherings for religious functions going on in South India. It's deeply worrying because even if a majority of those people become mildly ill and they recover, they will go home and infect people and set newer chains of transmission, which will get more and more difficult to contain. And it kind of propels an exponential movement of the virus through the population, which is worrying.
This brings me to a very important question here. One, we've seen evidence from the world over now that most of the people who are affected, who are especially at risk when it comes to life and health, are people who are older. Especially in Korea, where they're doing a lot of testing, they found that there are lots and lots of 20 to 29-year-olds who have caught the COVID-19, the coronavirus, but are not symptomatic in any way, are not affected in any way. So in that sense, should young people in their 20s really go through all these extreme steps where they themselves might not actually have a serious health risk?
Yeah, unless you're just selfish, because young people have parents and they have grandparents. And when young people who actually go out for work more, who are a part of the working population, meet more people, when they do not practice extreme social distancing, they become the vector that carries the disease back home or back to the people whom they love. And this will definitely cost their own family members who fall in the risk category. It will cost them their lives because their immunity is weaker than yours. And this is something, I feel this is something we should feel guilty about. I feel this is not something we should feel indifferent about. And at this point, I feel Indians are not taking this as seriously as the experts would like them to.
Right. And in this, there's also this extreme that we've seen, right? I mean, we've seen a few cases come out now where people have sort of fled quarantine or tried to, run away or go to some other place when the government is trying to, keep them under observation or, admit them in a hospital because they might be under risk or a test might have come back positive for a close family member. So what's your general advice for the person who might have a family member or somebody who's who's been diagnosed, for example, or is at risk? How should we be working with the government? Obviously, cooperation is important, but the idea of a quarantine is also terrifying, right?
Yeah, this is, like I said earlier, this is unprecedented for everyone. The government is asking all of us to act against our very basic reflex. And the thing is, if we have positive cases, if you know someone who has been tested positive, if the government system is working as they say it is, then the person will be first isolated while they wait test results. at an isolation center. And once the test result confirms them to be positive, they will be moved to a medical college or a district hospital, which each state has identified, where you will receive the medical attention you need.
Okay.
If you are in that position where you have a family member who's going through this, one hopes that you're not the person directly involved in taking care of that person, because we don't know how to. And India's first death, which happened in Kalburgi, was exactly this, where a 76-year-old man came back from Hajj and two private hospitals turned him away, and his family was responsible to find a transportation, take him to Hyderabad to a different hospital. By the time the tests came back positive, he had infected many, many, many more people. And
Right.
that's how I feel I just hope that people are not left to fend for themselves when they have a positive person in their families.
Right. And in India, healthcare is so attendant driven, right? Everything in a hospital works with the assumption that, you have this other person who's running around to get things done apart from the patient. And of course, here, people might be getting admitted into ICUs and so on, where it's a slightly different scenario. But yeah, I think a lot of challenges will be there in the healthcare system, even beyond what the doctors and the medical professionals will do, which we will come to in a while.
Yeah.
Vidya, in this time of crisis, there is a lot of misinformation that's also in the airwaves, right? Especially on WhatsApp. So what are some of the most egregious ones that you're coming across that people should definitely avoid?
The one that is really bizarre to me was that rasam, which is a Tamil dish that you eat with rice, can prevent coronavirus, which was bizarre. There was one, if I thought that was bizarre, at least that was safe to touch and edible. Yesterday, Johns Hopkins professor had to get on Twitter and tweet out this message specifically for India, saying cow urine will not help you. If anything, it will cause you more problems. And I kind of feel like, as a science reporter, I kind of feel like, how where you're in a class and there's this one weird student who has to get like very weird examples on how to behave in class. India is that, where the entire world is turning to science and looking at answers. And there has been some troubling issues, especially with the Ayush Ministry undermining the efforts of Health Ministry. Health Ministry has been scientific and is been putting out information that will actually help people, whereas a different arm of the government has been peddling magical remedies like homeopathy, which does not work. But for some reason, it's not even Indian, it's a Western medicine, it's popular in India, but it does not work. Unani, which is Greek medicine, Siddha, none of these things work. This is a new virus. We don't know anything about it. And WhatsApp messages, my advice as far as misinformation would be to not listen to anything on WhatsApp messages. The best would be to go to WHO and Health Ministry websites. They put out new information every single day, even at state level. If you are not comfortable with that, because it does get very technical, identify newspapers that you trust. Hindu is a good newspaper. Caravan is a great magazine. Wire, there are a bunch of regional publications. And trust science over superstition. That would be my advice, because we are just in the first phase of this, and we are already seeing that this pandemic is bringing out the worst in us in terms of racism, casteism, superstitious
Absolutely.
beliefs. Yeah.
And the other sort of misinformation that temperature is going to solve this, right?
No, temperature is not going to solve it. There is no evidence that suggests it with any degree of certainty. I keep getting messages from different parts of India, where yesterday a friend of mine walked into a grocery shop in Delhi, and the 24/7 shopkeeper had jacked up the temperature so high because someone told him that that would kill the virus. It makes the customers sweat more. If anything, this is a problem. It is not helping.
Right. So the idea that there is no cure right now and that we have to manage this is something that we have to live with, right? Because a lot of times in medicine, we turn to all kinds of crazy solutions because we want a remedy, we want a cure. And unfortunately, there doesn't exist one.
Yeah, this is one of those cases where we will have to wait out and only listen to what scientists and doctors and health ministries are saying. Anything else is not advice that is vetted by governments. It is not advisable to listen to that.
Right. And in terms of seriousness, I realize there's one thing that, again, what the government's doing reasonably well, at least here in Karnataka, is for the few patients who have tested positive, they've done a case tracking and put out a sort of a timeline of where all that person was at what time. And they've put this out, I think, on Facebook and elsewhere, of course, with the patient's name anonymized as P1 or P7 or something. And this is fantastic because a lot of people can at least go see if they were at any of those places at the same time. And if they were, probably they should be taking a few extra precautions. And so maybe that's one thing that people can also check out, right?
Yeah, so this
incidents
is
from their state.
Yes, this process that you explained is called contact tracing, and
Okay.
India as of now has 125 cases, which has led to the identification of 5,200 contacts who are currently being kept under surveillance by the health ministry.
Okay.
What this means essentially is think of this as concentric circles, and
Mm-hmm.
people who came in close contact with someone who tested positive for coronavirus are at a higher risk of becoming infected themselves and then potentially
Right.
passing on this infection. So
Right.
what the government does is it takes the contacts of people who were exposed to prevent further transmission, and then once someone is identified as a contact, the government actively follows up with them in case they show symptoms. And if they are
Right.
showing symptoms, they are identified and they are isolated, hopefully quarantined either at home or at a government facility. And they
Right.
wait till they are tested positive, their results come back.
Okay. And beyond this, they're putting out this information in the public as well, right? Because it's one thing about contact tracing, another if, say, an infected person walked through a mall on a Sunday morning, where I'm guessing that the government can't track down each and every person who was in the mall at the same time, and not every single person in the mall would have been affected directly anyway, right?
Yeah, I mean, the thing with contract tracing and especially how the Indian government at state level is doing it, health is a state subject in India, and whatever the center says is a guideline and an advisory that
Right.
they recommend that states follow. So it entirely depends on how robust the state level health systems are. So in the better of states like Kerala, things are being done better. But even at a central level, I'm sure you must have read this about how Rwanda 2 days ago cancelled all its flights to India after they got their first coronavirus patient who was an Indian citizen. Now,
Right.
from what I have spoken to people, I don't think anyone at this point is tracing every passenger on that flight right now.
Vidya, thank you so much. I mean, that was a great PSA, and we need a lot more awareness and a lot more action and a lot more just thoughtfulness, I think, amongst people, such that we sort of act with empathy and with thought for others and not just for ourselves. So let's take a quick break and come back, and let's talk about how the government of India has been responding to COVID-19.
Hi, I'm Sarayu Natarajan.
And I'm Alok Prasanna Kumar.
And we are the hosts of the Ganatantra Podcast.
On this podcast, we speak to academics, social scientists, journalists, and activists to find out what's actually going on in Indian politics.
On this podcast, we stay away from personality politics, intrigue, and gossip, and instead focus on the data, research, and analysis that drives all this.
So tune in to the Ganatantra Podcast, where new episodes are out every Wednesday on the IVM Podcast app, website, or wherever you listen to your podcasts.
Hi, I'm Pavan Srinath, and welcome back to the Pragati Podcast. I'm here with Vidya, and we're talking about COVID-19. Vidya, can you tell me, how did the government of India start responding to this, and when?
So the first case of the pandemic was reported in India on the 30th of January. It was from the people who were flown back from Wuhan. And
Okay.
as of 17th of March, we have at least 125 cases and 3 deaths, including one in Maharashtra a few hours ago. And
Okay.
I believe these are extremely conservative figures because we are not testing as much as WHO recommends us to. Now,
Right.
the second part of your question was how is the government responding? Well, I would say that so the governments have been slower than the virus, clearly, which is why this has taken pandemic proportions. But
Right. No, even there, when did we, I mean, you mentioned the first case, but when did sort of India first take note that, hey, this is happening and we should be doing something? Like, even in China, it was only in January that really news started coming out in a big way, right? Maybe the last week of December, there was some, I think the
yeah,
whistleblower and a few things out of there.
so I feel that India really started. So India government, the health ministry has been following this for a while, even since December. But between
Right.
December and February, we were kind of looking at that and being completely looking at Wuhan and just in shock of what is going on in Wuhan.
Right.
And by the time we realized, this is my opinion, by the time I realized the ministry was reacting, it was the second week of February at the least when they found 14 Italian tourists who had been going around multiple states, including Rajasthan, and are now in seeking care in Haryana. And that's around the second week of Feb is when the Indian government started full throttle to address this.
Right.
But then their intervention has been way slower than the virus because we also have a very weak health system at our disposal. So our lockdown should have been much earlier. We didn't do that. We should have started testing much earlier and more people. We have not done that yet. We should have set up
Right.
better quarantine facilities, which allows people to stay for 2 weeks without compromising their dignity. I don't know if you've seen photos coming out of quarantine facilities. People are running away, and I'd say that's because you can't stay for 2 weeks where the toilets are not clean and the food is really bad. So
Right.
those kind of issues are already coming in the way of our response.
So let's take this in various aspects, right? First, maybe let's talk about screening and diagnosis. So, like you said, it's around the end of January that we detected the first case in India, right? How is this screening process happening right now? Who is even being tested? And right now, what, about 6,000, 7,000 tests have been carried out so far?
Yeah, I think around 6,000. It's among the least in the world right now. And
Right.
how the screening is done on paper is, for starters, India has just limited testing to people who have a travel history and people who are in direct contact with them. That is
Okay.
changing
So,
as of
travel history to Wuhan or China.
no travel history to any part of the world where cases have been reported. And
Okay.
ideally, how this should work is you land at a airport in India, and then you fill a form, and the airport authorities have your details. When symptoms show up, they follow up with you, or you follow up with them. If you already have symptoms, they will follow up with you and take you and
Okay.
quarantine you. But I know from experiences of friends who just flew in from France and flew in from Malaysia that that's not happening. There is temperatures are not being taken at the airport. They are just taking
Okay.
contact numbers.
Okay.
So we are letting a lot of people in with infections and not tracking them. So we have an active blind spot to how the extent of local transmission is. And from the mathematical analysis that epidemiologists have done, cases are doubling every 6 days in India.
Wow. 6 days in India.
Yeah.
So 6 days from when? Because, if you count that doubling from a few weeks ago, then that number would be insanely high right now, right?
So if we tested everyone, we would know. Like I said, we don't know the true extent of testing. They're just mathematical models that epidemiologists are following. There is a website called Our World in Data, and
Mm-hmm.
which basically says, say in Italy, when things started spiraling out of control, and this happened very quickly in 2 weeks'
Mm-hmm.
time, and cases were doubling every 3 days. So right now in India, they say cases are doubling every 6 days, which is again concerning.
Okay. And India is also hitting that, is going to hit that 150 diagnosed cases mark soon, right? And in other countries, we've seen the takeoff of the virus and the infection really happen after, I think, that 150 mark, where from 150 it can go to 1,000 within no time.
That's
So we should
yeah.
really be watching out for what's happening in India over the next 2 weeks and how in what direction we might go.
Yes, over the next 2 weeks, we will know very clearly the extent of local transmission. So, at least for the next 2 weeks, the health experts are saying we should practice extreme social distancing because we
Okay.
can, yeah, but that's the only chance we have right now.
Perhaps on that front, how has the government done? So we talked about testing, and I'm going to come back to that and testing capacity and so on. But on social measures and social distancing, bans and restrictions on certain modes of travel, how do you think the response from the government of India and state governments, how has it been so far?
In this aspect, my sympathies actually lie with the government. India is an impossible country to have people. A third of humanity lives here. You cannot have a 6 feet distance between people. India is not that kind of a country where the measures that are required to be followed can be followed at this point of time. Cities like our mega cities, Calcutta, Mumbai, Delhi, the government has been telling what needs to be done. I feel at this point, as a community, we have not taken the responsibility. We are still going to religious gatherings. We are still going to temples. Some people are praying to the god, so going in big groups to temples to pray to the god, which is so counterproductive. Um,
Right.
and
This is a time for silent meditation, if not anything else, right? I mean, doing dhyana at home is probably a good idea in the time of COVID, as opposed to some
yeah,
of the other things.
I would say it's a good time for Vipassana. I mean, it's a joke. We are joking about it, but this is in 2 weeks we should brace for impact.
Right. And I know, I mean, it's a serious topic, but it's hard.
Yeah,
I mean, some of these things are so absurd in how horrifying they are that it's tough to grok all of it. But it's
yeah,
also coming. So the government is doing some good messaging, and largely it's left to state governments to come up with their own guidelines as to when to shut down schools or shut down malls and things like that, right? Because I think in Karnataka they've taken action at whenever they've seen fit.
yeah, yeah. So in India, health is a state subject, and so there are massive intrastate differences in health issues across India. So, say Madhya Pradesh, which has malnutrition issue, will not have the same kind of problem in Kerala, which is a more prosperous state. But the thing is, when something like coronavirus is on the prowl, people with weaker immunity, with malnutrition, and India is the cardiovascular capital of the world and the diabetes capital of the world. Uh, there are a lot of issues that already put us at risk because of our unhealthy lifestyles and weaker health systems.
Right.
So, again, I hope I am wrong about all of this, but I expect an Italy like trajectory in a couple of weeks. Yesterday's press release from the health ministry advised closure of
Mm-hmm.
every educational establishment, gyms, museum, just everything. And so it to me seems like even for the health ministry, they are also working on the assumption that in 2 weeks we are going to saturate and overwhelm our healthcare services.
Okay. So given that there's even cognizance of the government that, this is big, this cannot be avoided, and this is coming, how do you see existing measures? So, for example, right now you said, like, about 7,000 people have been, tests have been done. I think the number of people who have been tested probably is slightly smaller in number, because I think they've done more than one test on a few patients. That's one number. Any idea how many who might be quarantined or being advised to stay self-quarantined right now?
I remember from a couple of days ago, the press release said around 5,000 people. So
Okay.
between 5 and 6,000 people is what I'm expecting. As far as your question about, you were asking me how the government is responding. So in India right now, the government has decided that only government-run hospitals will administer care for coronavirus, and only
Right.
government-run centers will test. The laboratories will test for coronavirus.
Right.
So there is again a huge difference between how states are responding. Karnataka, Maharashtra, and Kerala have most of our cases right now. and Kerala is among the better equipped states to respond. But again, there is a problem that there is no way to know. We cannot be sure because we are not testing enough people in UP and Bihar, and then there is this accompanied problem that as compared to say Kerala, where the health system is better, or say Bihar, where the government, the chief minister has said that the government will take care of the expenses for this disease. UP has a chief minister who recommended yoga for coronavirus. So those kind of things are a serious concern for me at this point. And I feel like the government's response is not well coordinated.
So you've been reporting on what's happening with testing right now. Where do you think the bottleneck is? Does the government do you sense unwillingness to test, or is it that we have supply constraints for these tests? Can you give us a sense of what's going on?
This is again one of those issues where everyone is a little bit to blame. There are historical reasons why we do not have the lab capacity. We do not have the best lab is National Institute of Virology in Pune. And in some cases, in the first case in Kalburgi, it took 4 days for the test results to come back. The government is talking with private sector, but before that, they have to acquire WHO qualified kits and validate them. Like there's no point putting inferior quality tests in the market. And then there is something called a reagent, which is required to run the test. Now, all of this has to, usually under normal circumstances, there is a WHO qualification for what is the minimum quality that is acceptable. And there are vendors who have to pass that test and you buy from them. India at this point, the delay that we have on testing is because we are still finding, from what I understand from people I have spoken to, we are in the process of validating and procuring the tests. They should be, the minute they become available, they will give it to private labs to test. So this reagent has to be given by the government to the private labs so they can run these tests.
So it's not like the private sector can procure this on their own right now.
No, they cannot do that. But what I feel, my concern is whenever these tests do come into India and in enough quantities that they can have private sector test them, my worry is that the government will not put a price cap on it. And from my understanding, each test will cost upwards of 6,500. In a government hospital, it's costing that much. So a private player will be free to take wartime prices. And that is a concern that I worry about that a lot.
So if the government is spending 6,500, then that's the cost to government, right? So whoever is selling the equipment for it, the reagents and so on, is charging those prices. Is that sort of the scenario? Or is there the sort of local private sector sort of profit margins to be added on top of it?
Again, this is not a very transparent process. I'm putting out the information based on the people I have spoken to within the health sector. What my understanding of it is that this is called pool procurement within the health sector. And we do it even as individual customers. When you buy something at wholesale, you want a discount, right? The government at this point is speaking to private players, and my concern is they are not negotiating on a discounted price the way, say, European nations or say South Korea is universally testing and it's available for free. So there are governments who have, and I'm okay with taxpayer funding it because this is a crisis and this is what taxes are for. But then my understanding of the Indian health sector is that there are going to be private players who are going to look at every crisis as an opportunity and be making money hand over fist because of this crisis, which will then exclude a lot of very poor people in the poorer states in India.
Okay. So if this is a scenario, right now, I'm also reading one interview with the ICMR Director General, Professor Balram Bhargava, where he sort of says that right now the capacity for testing, so one is getting the stock or the flow of all these supplies, right? And the other is whatever actual lab capacity we have. And the government view seems to be that they have the capacity to conduct about 5,000 tests a day. And right now we seem to be only doing about maybe 70 to 100 tests a day. So from the government side, there's also this one narrative that says that testing is not a limitation on the government side. I mean, when we want to test 5,000 or even expand that to maybe 10,000, we are able to do it. And then sort of these narratives that, no, you need to involve the private sector to be able to run tests at scale. So, and in all this, I'm not even able to get a sense of what might even the peak load be. Is 5,000 tests a day or even 50,000 tests a day enough for India? These are all questions that we are not able to get good answers to right now.
So there are two aspects. Thank you for asking that question. There are two aspects to what you're saying. I have been reporting on this for Caravan over the last week. If the government is saying they are running at 10% tests, lab capacity, the obvious question for me is, and this is not even a question from me, I was speaking to a doctor at a district hospital in Maharashtra. It is heartbreaking to get on phone calls with doctors who are very frustrated that they cannot take care of their patients. This particular doctor had a older gentleman who he was caring for who was on ventilator support, and the doctor recommended a COVID test at the district laboratory, district hospital's lab, which the lab refused. And I don't understand, if you have 10% capacity, why are you refusing a doctor who thinks the patient might be dying of COVID, but then that's a statistic that you're not including in your overall reported number of cases. The second aspect of this is the ideal response would be that the 10% of lab, I hope the government is correct. I hope Dr. Bhargava is correct when he says the lab capacity is at 10%. So when it reaches 90% or 70%, the government should negotiate with the private sector to allow testing for whatever capacity that is needed at that point. Again, what I don't understand in the government response is that if they are performing at 10% right now, why are they already talking to private labs at exorbitant prices for each test? These are the kind of questions which makes me wonder that at a moment of crisis, are we prioritizing profit over national health security?
Right. And the other future that's possible is the government will ramp up to whatever capacity it can and do tests for free based on a very restrictive, perhaps, set of rules as to who gets tested. And it just becomes over the counter in the private sector, right? So if I, with money and privilege, want to go get myself tested, or if I go to a hospital, private hospital, and they want to get me tested, I can, because I have 6,000 rupees to spend on that, but everyone else has to rely on the government. Yeah. So that is one possibility, right?
See, the thing with that approach, which if that's what happens, again, every TB researcher and a doctor will tell you this is an infectious disease. This is exactly the kind of disease where no one is safe unless everyone is safe. So India in particular, which has a very serious issue of medical apartheid, where if you go to depending on how much money you have in your pocket, medicine changes, the line of treatment and science that you have access to changes. Whereas our constitution basically allows every Indian citizen right to scientific progress. But that's not happened in 70 years, where if you go to a district college or a district hospital for treatment, the line of care you get and the manner in which you get is what in public health circles is known as medical apartheid. And coronavirus pandemic is exactly what's going to test it. So yeah, you may be able to afford, you are going to a path lab and testing for 10,000 rupees. But I'm sure if you have a driver or if someone comes at your place to cook, you will forever remain at the same amount of risk.
Absolutely. So we'll have to figure out how the government of India ropes in the private sector just to expand capacity and, do peak load, high throughput testing. But at the same time, we have to figure out how to have maybe South Korea style universal testing or something towards that end, right? So we'll really see what's going to happen over the next couple of weeks. Hopefully there are discussions happening right now which will lead to something fruitful and not something tragic.
Inshallah. One hopes.
Okay, so that was on testing, right? You also mentioned about certain hospitals being designated to treat coronavirus patients. So if we are talking about, a big Italy-style load coming on our healthcare system in the next 2 weeks, many patients being admitted, many people being admitted to intensive care, are you getting a sense from the government or anywhere else on how they are planning to respond to this?
I am, and it's not looking very well. I was looking at some report yesterday for some random research, and I found that all of Chhattisgarh, with this report was about Chhattisgarh, it has a population of 32 million people. It has, I think, 130 or 100 and between 130 and 150 ventilators, and it may be within the government sector, and it maybe has 20 specialists who know how to work a ventilator. And
Wow.
yeah, and that is going to be a massive problem. And then again, private sector does not want to waste its ventilators on non-paying patients. Again, we are going to keep
No, but
coming
even
back.
if we add up the private sector, how much does that even go up to, right? Even in a richer city like Mumbai or Bangalore, even if you include the private sector, it might not be enough, right?
For sure. We can very safely say that, yes.
Right. So of course, I mean, there's going to be access issues, but even if you just take all existing private and public healthcare infrastructure and medical professionals in India, we just don't have enough, right? I mean, we have seen the stats for decades now.
Which is why I am baffled that we are already not throwing everything we have at it. Because even when we do, it's not enough, and we have wasted. It's now 15th or 16th of March, and even if from 15th of Feb, if we had started responding at the level of seriousness which factored in the next 3 months, and looked at my sources tell me that the health ministry is almost done counting the resources we have at disposal, and it's not looking good.
Okay. So, but there has been an inventory and stock taking that's happened.
It's going on. Again, it's a state level thing, and state governments have been told to do it. It's different in states that are better off. It's some states that don't have. There are very local issues with this.
One thing, finally, we talked about contact tracing before. Apart from the hospital system, where do you see the role of sort of public health officials? Public health itself is a funny word in India, right? Because we have public healthcare and we have private healthcare, but public health is somehow lost in all of that. And even before talking about the quality of public and private healthcare. So, who do you see who are hopefully either already acting on it or who need to act on it, along with the hospital systems, which have to take a big load soon?
It's an interesting question. It's just difficult to answer at this point because the government has restricted testing and treating only to itself. So right. The only person who is allowed to take initiative here is the government itself, and there's a lot of centralization going on. So even well-meaning public health experts who really want to do their bit here aren't able to do anything because it all has to begin with testing. And if the labs are refusing tests, how do you know where to begin with? It's like today the WHO Director General, Dr. Tedros, again had a message where he said that our message to countries is test, test, and test, and we cannot fight a fire blindfolded. That's what India is doing right now.
Okay, so hopefully we'll get to know more about the tests going through the rigmarole of, meeting certain standards and being available in large enough quantities. And if I'm not mistaken, though, I mean, the tests might be WHO approved, but the vendors, we are buying from China and elsewhere, right, for some of these kits and reagents that are currently even being used.
So it doesn't matter where we buy from, so long as it is WHO approved. There is a very strict qualification, and if it's been validated, when it comes to India, it's validated, and once it's been validated, it's all the same standard. So I would not worry about where the origin of the test is. I kind of, at this point, by the end of the week, my sense is private labs will be allowed to test because even as of today, there's been a meeting about to figure out the specifics on how many labs and where and at what cost. So all of that should be more clear by the week. But the thing is, every day we waste There are people out there who are setting new chains of transmission, and these are people who would have taken precautions if they had the information, which at this point the government is not sharing.
Right.
My worry is coronavirus is now here. We with pandemics we know that the experts are expecting two waves, and the second wave is harder. But then eventually it kind of comes to a point where it becomes endemic in the population. My genuine
Right.
worry is about the impact it's going to happen. Like I mentioned earlier, we already have two other horrible respiratory diseases. And with the air pollution and the TB burden that India has, it's a little frightening because as a nation, we have a weak immunity. And then as a nation, we have a very weak healthcare system. Um, I am concerned.
And so after all the horrors that might happen now, something like COVID might also enter the gamut of various Indian infectious diseases that are always there in the pool, right? Like now dengue is a part of our social reality. Chikungunya was an outbreak, right? In 2002 or so. And now it's just a part of our ecosystem. And having another deadly disease like this enter our ecosystem also gives a lot of trouble.
That's our best case scenario, that it kind of finds its equilibrium. This is how all new pathogens came in. The HIV virus jumped from from monkeys to humans. And after taking pandemic proportions, it kind of becomes manageable. But then all of that is so much far in our future. Right now, we need to hunker down and we need to listen to scientists. And there is this question, like I get criticized a lot for being alarmist at this point. And the Indian journalists, especially my reporting for Caravan, there has been concerns about how I'm blowing things out of proportion. Look, I ask that question to myself every day when I file the story. And looking at the data, let's assume 80% of the cases are mild. But even with what is categorized as mild, there is no clear definition as yet. We don't know the fatality rate completely. In some weeks it goes really high. Some weeks in Wuhan the fatality rate was 5%. And the Chinese government, the methods the Chinese government used to bring it under control are not possible for India. They also built a couple of hospitals in record time. Again, that's not something India can do. I feel, again, WHO does not use the word pandemic very seriously. This is not the kind of organization which is very dramatic. We should all be taking this way more seriously than we are taking right now. We don't know a lot about the virus. We won't know until it's all over. And I'd love to be told at the end of it that I was wrong and I was an alarmist journalist. But this is an unprecedented global event.
Yeah, and maybe to wrap things up, I mean, the numbers which sound so scary is, there was an estimate by, I think, a retired virologist at CMC Vellore, and this is basic numbers, right? If we have 1.3 billion people in India and about 800 million adults, and if we just look at the adult population and we say that, over time, maybe 10% of Indian adults get exposed to the virus and get infected, and 10% of that 10%, so 1% of India's adult population develops some kind of severe illness, that's 8 million people. Right? 8 million. And even if of that there is a 1% fatality rate, that's 80,000 people, right? And 1% is way more conservative than what we are actually seeing in China and elsewhere, right? So and if that case fatality rate in Indian healthcare systems is 2%, that number doubles to 160,000 people who might die of this just this year, right? And we are not even talking about what happens if more than 10% of the adult population gets infected. So the base numbers for this are scary, and we should be afraid. We should not panic, but we should be worried.
Yeah, my parting word of advice here would be that I read this on Twitter where someone very brilliantly summed it up, that we need to shift the mindset from trying to not get infected to assuming that we already are infected and do not want to spread it to others. The key to success here is collective responsibility. That's the only way we are going to survive this. We cannot be fighting each other as right wing or left wing or distrustful of scientists and intellectuals. We are all in this together, and we need to take collective responsibility. I feel the only way across is through it, and we have to prioritize being kind to each other, being kind to people we do not even know.
Definitely. Vidya, thank you so much for joining me on the Pragati Podcast. It was an absolute pleasure to have you here. And we all hope that we are wrong in this, but I hope we are prepared for what is to come. Thank you so much.
Stay safe. Thank you for having me over.
My pleasure. Thank you for staying with us till the end. If you have any questions or comments, do write in to podcast@thinkpragati.com. And hey, if you like the podcast and listen to us on iTunes or Apple Podcasts, please leave us a rating and a review. It'll mean a lot to us. The Pragati Podcast is available on the IVM Podcast app and pretty much every other podcast app and platform. We are there everywhere.
नमस्ते, मैं हूँ सौरभ चंद्रा
और मैं प्रणय कोटस्थाने।
जब महफिल खत्म होते होते दरवाजे के बाहर पुलिया के ऊपर हम दुनिया भर की जटिल समस्याओं को सॉल्व करने में लग जाते हैं तो हो जाती है पुलियाबाजी।
अब आजकल के अपार्टमेंट वालों ने तो कभी पुलिया देखी नहीं होगी, पर आप फीलिंग तो समझ ही सकते हैं।
तो आइए शामिल हो जाइए हमारी पुलियाबाजी में, जहाँ प्रणय और मैं एक से एक इंटरेस्टिंग टॉपिक्स की तह तक जाएंगे।
आर्टिफिशियल इंटेलिजेंस, बिटकॉइन, पाकिस्तान, मेडिकल एजुकेशन, करेंसी क्राइसिस, कभी हम दोनों के साथ और अक्सर स्पेशल एक्सपर्ट गेस्ट की कंपनी में।
सुनिए हमें IVM की वेबसाइट, ऐप या अपने फेवरेट पॉडकास्टिंग प्लेटफॉर्म पर हर दूसरे हफ्ते।
Do you wish you were smarter? Well, so do we. But the next best thing?
We could make you sound smarter.
And to help you with this endeavor, we are Simplified, a podcast that attempts to break down the complex world around you with a little knowledge, a lot of poor jokes, and a ton of random trivia.
Episodes out every Monday.
On the IVM Podcast app or wherever you get your podcasts.
See ya!